Let me give you a picture you may recognize instantly. You're 67 years old. You're not bedridden. You're not fragile. In fact, you feel pretty good. You're enjoying retirement. You're traveling a little more. Sleeping a little better. Finally, living at a pace that feels like yours. Then one routine appointment changes everything. Your doctor says, "Let's do a few extra tests, just to be thorough." That sounds responsible. That sounds smart. That sounds like good preventive care. But a few days later, one of those tests finds something small. Not dangerous. Not urgent. Just something. Now, you need another scan. Then a specialist, then a biopsy. Then a procedure. Then a complication. And suddenly, the biggest threat to your health was not the illness you had. It was the medical momentum you stepped into. That is not a rare story after 65. And the truth is, most people are never taught one of the most important rules in modern medicine. A test is not harmless just because it's routine. I'm Dr. Adrian Cole, and this is Senior Health, a channel dedicated to helping adults over 60 protect their health, their independence, and their quality of life using clear, evidence-based guidance in plain English. And today, I'm going to walk you through 5 medical checkups I would personally think twice about after 65, not because doctors are careless, not because medicine is bad, but because after a certain age, the equation changes. The older you get, the more one question matters. Will this test improve my life, or simply create a problem I never needed to carry? That's the filter I want you to use through this entire video. Because after 65, healthcare is no longer just about finding more. It's about protecting more. Protecting your energy. Protecting your mobility. Protecting your brain, your confidence, your freedom, your ability to wake up and enjoy your own life. And stay with me until the end of this series, because checkup number 3 is one of the most commonly recommended tests in older adults and one of the most misunderstood. And checkup number 5 is the one that quietly pushes a lot of healthy seniors into treatments they never truly needed. Before we begin, I'd love to hear from you. Where are you watching from today? Drop your city or country in the comments. I read them, and I genuinely love seeing where this community is growing. All right, let's begin with checkup number 1. Checkup number 1. Annual full body scans without symptoms. This is one of the fastest growing trends in private medicine: executive wellness, premium health screening, and so-called longevity care. It's marketed beautifully. Catch disease early. Scan everything. Get peace of mind. Stay one step ahead. But for many adults over 65, what these scans really deliver is not peace of mind. It's incidental findings. Tiny cysts, harmless nodules, age-related changes, shadows that mean nothing, variations that are common, stable, and never would have affected your lifespan in any meaningful way. But once they're found, they're almost never emotionally harmless. Because now you know. And once you know, the follow-up machine begins. More imaging, more contrast dye, more referrals, more waiting, more fear, and sometimes more risk than the original scan was ever worth. Here's the danger no one explains clearly enough. The more aggressively you look in a healthy older body, the more likely you are to find something abnormal that is not actually dangerous. That does not always create better outcomes. Very often, it creates better billing. And I'm going to show you the second checkup I would avoid after 65. A test that sounds heart protective, looks responsible, and has led countless older adults into procedures they never needed in the first place. Checkup number 2. Routine cardiac stress testing without symptoms. Let me show you how this usually happens. A woman in her late 60s pays for a premium full-body scan because she wants to stay ahead of anything serious. She feels fine. No red flags. No symptoms. The scan report comes back with a few findings. A tiny lung nodule. A small kidney cyst. A shadow on the liver that is probably benign. But the radiologist recommends follow-up imaging just to be sure. That phrase, just to be sure, sounds harmless. But in medicine, it can become the doorway to a completely different life. Now she needs more appointments, more contrast dye, more waiting, More worry. She starts Googling. She stops sleeping. Her family gets anxious. And after weeks of escalating fear, she finally learns that none of it was dangerous. Nothing life-threatening. Nothing that would have shortened her life. Nothing that needed to interrupt her peace in the first place. And that is the hidden cost of unnecessary screening after 65. Not every abnormality is a threat. Not every finding deserves a chase. And not every test that promises prevention actually protects you. In younger people, aggressive scanning can occasionally uncover something meaningful early enough to change a long future. But in older adults, the same approach often uncovers age-related noise, harmless findings that trigger expensive, stressful, and sometimes risky follow-up. So what would I do instead? If you have symptoms, that is different. If you have unexplained weight loss, persistent pain, blood where it should not be, unusual fatigue, or a real clinical concern, absolutely investigate. But if you are symptom-free and being sold the idea that scanning everything equals smart aging, I would slow that conversation down immediately. Ask one simple question. How often does this kind of scan find things that never would have harmed me? That question alone can save you from a cascade you never needed. Now, let's move to checkup number 2, because this one is incredibly common, sounds extremely responsible, and has pushed a lot of healthy older adults into invasive cardiology workups they never truly needed. Checkup number 2. Routine cardiac stress testing without symptoms. This one catches people off guard, because it sounds so reasonable. You're over 65. Your doctor says, let's check your heart. We should make sure everything is okay. And the truth is, that sentence feels comforting. Who wouldn't want reassurance about their heart? But here's the problem. A stress test is most useful when there is a reason to suspect a problem. Chest pressure, shortness of breath with exertion, dizziness during activity, a meaningful change in exercise tolerance, or a risk profile that genuinely justifies the next step. Without symptoms, what often happens is not prevention, it's over-detection. A slightly abnormal result leads to another scan. That scan leads to a cardiology referral. That referral leads to catheterization, and catheterization can lead to stents, medications, bleeding risk, anxiety, and a label that changes how you see yourself forever. All from a test you may never have needed. I've seen this pattern change the psychology of healthy people more than their actual outcomes. A man who used to walk every morning now becomes afraid to exert himself. A woman who felt energetic suddenly starts thinking of herself as a heart patient. Their world gets smaller, not because their health clearly failed, but because one borderline result pulled them into medical momentum. And here is the part most people never hear in a rushed appointment. Finding a blockage is not the same as improving a life, especially after 65. Many people have some degree of arterial narrowing. That does not automatically mean a procedure will help them live longer or feel better. What do you do instead? If you have symptoms, evaluate them quickly. Seriously. But if you feel well, I would focus first on the foundations that actually move cardiovascular outcomes. Blood pressure, blood sugar, sleep quality, walking capacity, inflammation, nutrition, muscle mass, and medication review. Because real heart protection is often much quieter than people think. It is not always a machine. Sometimes it is a daily routine. And I'm going to cover the third checkup, one of the most emotionally loaded in modern medicine, because it uses one terrifying word to drive decisions that many older adults later regret: cancer. Checkup number 4. Carotid artery ultrasound without symptoms. Let's talk about the word that can hijack a person's judgment in seconds. Cancer. The moment a scan, blood test, or screening report suggests even the possibility of cancer, everything changes emotionally. Logic gets quieter. Fear gets louder. And that fear is exactly why this next checkup needs to be handled with extraordinary care after 65. Checkup number 3. Aggressive cancer screening in low-risk, symptom-free adults. I want to be very precise here. I am not saying cancer screening never matters. It absolutely can save lives in the right patient, at the right age, with the right risk profile. What I am saying is this: after 65, especially as people move into their 70s, aggressive screening done automatically without symptoms without individual risk review, without any conversation about whether treatment would actually improve life, can create a serious overdiagnosis problem. That means finding cancers or suspicious lesions that are technically real, but so slow-growing, so biologically quiet, or so unlikely to affect lifespan that they may never have caused harm. But once they are found, the machine starts moving. Biopsy. Consult. Repeat imaging. Surgery discussion. Radiation. Side effects. Complications. And often, nobody stops to ask the question that should have been asked first. If we find this, will treating it meaningfully improve this person's quality of life? That is not a small question. That is the entire question. A low-risk older man with no symptoms gets a PSA test. It comes back elevated. Now he is in a urologist's office hearing words like biopsy, lesion, surveillance, radiation, intervention. He walked into the original appointment, feeling healthy. Now he leaves with a medical identity he never expected. A woman with no symptoms continues annual imaging out of habit. Not because anyone carefully reevaluated whether the balance of benefit and harm still makes sense for her age, health status, and overall life expectancy. This is what autopilot medicine looks like. And autopilot is dangerous in older adults because the older body does not absorb treatment the way a younger body does. Recovery is harder. Complications last longer. Independence is more fragile, and sometimes the treatment costs more life than the disease ever would have. So what do? You do not say yes automatically. You ask better questions. Ask, if this test finds something small, what would we realistically do next? At my age, would we monitor it? Or are you already imagining treatment? And what are the downsides of finding something that may never hurt me? Those questions change the room. Now let's go to checkup number 4, because this one sounds like stroke prevention, and that is exactly why people agree to it so quickly. Checkup number 4, carotid artery ultrasound without symptoms. The pitch sounds almost impossible to refuse. We're just checking the arteries in your neck to make sure you're not at risk for a stroke. That sounds intelligent. That sounds preventive. That sounds like exactly the kind of thing a careful older adult should do. But here's the problem. In many symptom-free adults, carotid screening finds narrowing that has likely been sitting there quietly for years. Stable. Silent. Not causing trouble. But once that narrowing is discovered, the conversation often shifts from finding risk to fixing anatomy. And those are not the same thing, because once procedures enter the conversation, so do procedural risks. And ironically, one of the things a person may be exposed to in the name of stroke prevention is stroke. That is why this test needs context, not reflex. If you have had mini-stroke symptoms, sudden weakness, facial droop, speech trouble, or temporary vision loss, that is a completely different situation that needs urgent medical attention. But in a person who feels well and has had none of those warning signs, screening the neck, just because it sounds prudent, can create a problem where there was only risk on paper. And I'm going to show you the 5th checkup, one that millions of older adults continue almost out of habit, even when their individual benefit may have dropped sharply. Checkup number 5, repeated colonoscopy on autopilot. The real principle behind all 5 now, we come to a checkup that many people think of as automatic. If you've been a responsible adult your whole life, you probably already have a mental script for this one. Every so often, I get my colonoscopy. That's what smart people do. And for many years, that mindset makes perfect sense. But after 65, and especially as people get older, remain symptom-free, and already have a history of normal results, this decision should stop being automatic and start becoming individualized. Checkup number 5, repeated colonoscopy on autopilot. Here is where people get trapped. They assume that because a test was useful before, it must remain equally useful forever. But that is not how medicine works. And it is definitely not how aging works. A person in their late 60s or 70s who has had prior normal colonoscopies has no symptoms, no meaningful family history, and no new red flags is not in the same decision category as someone screening earlier in life or someone with active warning signs. And yet many people keep going through the process simply because the reminder shows up. The system suggested. and nobody slows down long enough to ask whether the potential benefit is still worth the burden. Because, let's be honest about the burden, the prep alone can hit older adults hard. Dehydration, weakness, confusion, blood pressure swings. Then there is sedation, recovery, potential complications. And then, if something tiny is found, you are back inside the cycle again. This is why age-based medicine fails so often. It focuses on whether a person is old enough to qualify for a test. It forgets to ask whether that person is healthy enough to benefit from the entire chain of consequences that may follow. And this is the deeper principle behind all 5 checkups in this video. The issue is not testing itself. The issue is context-free testing. A full-body scan without symptoms. A cardiac stress test without symptoms. Aggressive cancer screening without a clear treatment conversation. A carotid ultrasound without neurologic symptoms. A repeated colonoscopy without re-evaluating risk, history, and likely benefit. What do all of them have in common? They can pull an older adult into a medical story that begins with reassurance and ends with unnecessary intervention. That is the danger. Not every test improves outcomes. Not every early finding is a gift. Not every action equals wisdom. Sometimes wisdom is restraint. Sometimes wisdom is monitoring. Sometimes wisdom is saying, before I agree to this, I want to understand what happens after the result. And if this is changing the way you think, let me ask you something important. Have you ever gone into a routine appointment expecting reassurance and walked out with a new fear you were never prepared for? If you have, you already understand exactly what this video is about. Because what older adults need most is not more medical noise. They need clarity. And I'm going to give you the exact framework I want you to carry into your next appointment. A short set of questions that can completely change the power dynamic between you and any doctor recommending a test. The 5-question protocol every adult over 65 should use. So here's the practical takeaway. I do not want this video to make you fearful of medicine. I want it to make you smarter inside medicine. Because there is a huge difference between a patient who passively follows momentum and a patient who knows how to slow the room down and ask the question that actually matters. If you are over 65 and a doctor recommends a screening test or checkup that you were not expecting, I want you to remember this protocol. Not 10 questions. Not a complicated script. Just 5. The first question is, what happens if we do nothing for now? That question is powerful because it exposes urgency. Sometimes the answer is, we really should not wait. But sometimes the honest answer is, we could monitor this safely. And those are 2 completely different situations. The second question, if this test finds something, what is the most likely next step? Because people say yes to tests without realizing they may actually be saying yes to a biopsy, a procedure, long-term medication, repeat imaging, or specialist follow-up. The third question, would treatment at my age clearly improve either how long I live or how well I live? That question cuts through vague medical language fast, because after 65, longer life is not the only goal. For many people, the greater goal is protected independence, protected thinking, protected mobility, protected peace. The fourth question, what are the downsides, risks, or false alarms this test can create for someone like me? This is where you stop being managed by optimism alone. Every test has a false positive story. Every test has a version of harm that almost never shows up in the brochure. And the fifth question, the one I wish more older adults would ask, is there a safer, simpler, less invasive way to manage this risk first? That one question can redirect an entire appointment. Maybe the answer is blood pressure control. Maybe it is medication review. Maybe it is balance training. Maybe it is sleep optimization, weight management, walking, muscle preservation, or watching symptoms over time rather than chasing a scan today. That is what real senior health looks like. Not panic, not passivity, not automatic compliance. Discernment. I want to leave you with this. After 65, the most dangerous phrase in healthcare may not be, you have a disease. It may be, let's just check. Because hidden inside those 3 words can be appointments you never needed, procedures you never wanted, stress you never deserved, and a version of old age that becomes smaller, weaker, and more medicalized than it had to be. Please hear me clearly. You are not difficult for asking questions. You are not ungrateful for wanting context. You are not irresponsible for saying, "I need to understand the full picture before I agree." That is not resistance. That is wisdom. And sometimes, the healthiest decision an older adult can make is not to do more. It is to refuse unnecessary momentum before momentum starts. If this video gave you a new lens on your health, subscribe to Dr. Adrian Cole Senior Health. Every week, I share practical, evidence-based guidance to help adults over 60 protect their energy, avoid preventable harm, and stay independent for as long as possible. And now I want to hear from you. Have you ever had a routine checkup or test that led somewhere you never expected? Leave it in the comments, because your story may be the warning that helps someone else ask one better question before it is too late. Take care of yourself, and I'll see you in the next video.